2135 Delegate Levine, and then we've got the 1704 to follow.
Thank you, Mr. Chairman, members of the committee. The 2135, first I'd ask that the amendment nature substitute be agreed to by this committee.
Entertain a motion to adopt the sub. Just moved. All in favor, signify by saying aye. Aye. Opposed. All right, tell us about the sub.
So what the sub does is it adds cannabinoid oils to treatment of cancer. And I'm proud to say that I do have NIH peer-reviewed scientific studies that I'm about to share with the committee. Just briefly, I would note that the current treatment for cancer includes opioids, includes benzos, includes highly addictive, highly toxic substance, unlike cannabinoid oils. And that these oils, it should be very, very clear, they don't get you high. You cannot smoke them. They're drops. And the exciting thing, and the reason that I'm going to share these studies in a second, is that they actually do a lot of good. I have studies from NIH and the New Jersey Medical School, from GW, from University of Washington, from British Journal of Pharmacology, one in Italy, one in Israel. But the two of them, and actually the original study was at UVA, that it had its effect in 1975. But the real exciting ones, I'm going to share with you two of them that I'd like to share with the committee, are from right across the way from VCU and also from Harvard Medical School. I'd like to distribute these. These are two separate studies. They're just stapled together for convenience. And here's the exciting thing in these two studies. If you look on the front page, and I've underlined it, this is the study from Virginia Commonwealth University Medical School. It says that plant-derived cannabinoids induce apoptosis in leukemic cells. In other words, they kill leukemic cells. It leads to cell death. That's a pretty exciting thing in cancer, given that leukemia obviously will kill you if you don't kill it at first. The second study, on the second page from Harvard Medical School, shows the power of these cannabinoids to work with chemotherapy. Now, obviously, chemotherapy, while necessary to survive, is in itself a poison, extremely dangerous. And what the Harvard study shows is that for non-small cell lung cancer, which is the leading cause of cancer deaths worldwide, there are only limited therapeutic treatments. And they looked at cannabinoid receptors, and they found that they significantly attenuated random as well as growth factor-directed in vitro chemotaxis and chemoinvasion in these cells. In other words, the chemotherapy doesn't kill the cells that we don't want to kill. It actually helps, you see in the next line that I've underlined, inhibit in vivo tumor growth and lung metastasis. The people that I have to testify will tell you that they've suffered from cancer, that the chemo drugs, although perhaps necessary to save their lives, can cause kidney damage, nerve damage, nausea and vomiting, hearing loss, disturbance in balance, and other things that, again, by limiting the impact of the chemotherapy, as the Harvard Medical Study shows, can actually help them. So, Delegate Albo, you rightly asked for peer-reviewed National Institute of Health science, and I've tried to provide that for you today. Delegate Albo.
Delegate, on that second study, it says CB1 and CB2. Is that cannabinoid oil?
They are cannabinoid receptors, CB1 and CB2.
How do I know? Maybe your witness would.
My witnesses know more about this than I do, I assure you.
Okay, what I can know is this cannabinoid oil, or THCA oil, is that what they're talking about in this Harvard study?
I believe so, but again, my experts know more about this than I do, and they will certainly testify in a minute. Thank you.
You have somebody who'd like to present some information, please?
Good evening, gentlemen.
Good evening. Tell us your name and tell us your thoughts on this measure.
My name is Brian Wilson.
Hi, Mr. Wilson.
I'm currently been diagnosed with a fibromyxoid sarcoma that I'm using this oil with success to treat. I just got back from Texas, surgery down in Texas, where they had attempted to go in and try to get some of the tumor out as much as they could. Unfortunately, they were not able to get to any of it. It's wrapped in this area called the cavernous sinus, deep up here, my head. It's wrapped around the carotid artery, the place where the carotid artery is the thinnest. So radiation is out of the question. The only treatment that they have offered, and I'm going back down to speak with my oncologist again in a couple weeks, is chemotherapy. We're going to talk a little bit more about that. Before I went into surgery, I got the opportunity to sit there with my neurosurgeon and go over some of my imaging. One that was, 2 or 3 months old, and another one that was only a few days old. And we got to look at the tumor size and some of the infection that I had going on up here as well. And to our surprise, well, I guess, I don't know, maybe not surprised, we were very excited to see that the tumor had gotten smaller. And the only thing that can be attributed to this is the cannabis oil. So this is putting me in a position where I'm considering, and I've heard other people do this before, being able to turn down chemotherapy and continue with this cannabis oil wrap, which is incredibly empowering. It takes me out of the danger and the effects, all the negative effects of chemotherapy. I'm floored. I'm beside myself. I'm so happy with this stuff. And it's helped me in many other ways. There's things that go along with this diagnosis and being sick. It's hard to put into words. Symptoms, things that kind of start moving against you, your appetite, have problems with. And just a lot of everyday things that normally we don't think of. Normally they're not a problem. And since I've started this oil, all these things have come flooding back. I cannot speak enough about this stuff. And I'm just really excited about it. And I really, really hope that you guys would really take a very good look at this, because this is saving people. And it's saving me right now. So, anybody have any questions for me?
Thank you.
Thank you.
Thank you, Mr. Chairman, committee members. Thank you for your thoughtful considerations and suggestions. I really do appreciate this opportunity to address this legislation again this session. I look to you all for direction in helping patients like myself and Brian, who are the fortunate ones who can stand before you today to testify on behalf of those who cannot because they're in the hospital or they're dead. You've heard my story before, and briefly, my daughter was 1 the first time I was diagnosed with lymphoma. After 12 doses of chemotherapy, I thought it was over, and 6 months later, they told me unequivocally, you will die, or you have one option. I was given one option that had an okay chance, maybe, if you live through the therapy, if you live through your stem cell transplant. Then that's your only chance for a cure. There's a 20% chance that you're not coming out of that hospital room just by having that chemotherapy for the transplant alone. The chemotherapy that I had causes leukemia. I'm in a desperate rush to beat my next relapse, to beat leukemia that I watched my aunt at the same age that I was my first diagnosis not live through. We've heard a lot of testimony about the palliative benefits of these oils and how it mitigates nausea, helps with pain. But what's critical for cancer patients is that it offers curative options I firmly believe that there are palliative benefits, of course, but that's not the hope, and that's not what makes this critical. Okay, CBD, as we all know, is non-psychoactive. It's been shown in multiple studies before you, some of them, to kill cancer cells, to prevent their proliferation, to keep tumors from forming blood supplies, and to work synergistically with many current first-line chemotherapies, greatly increasing their efficacy while at the same time mitigating cellular damage. I have hearing loss, profound joint damage, damage to my heart muscle, damage to my lungs, pulmonary fibrosis from one of my chemotherapies. The therapies that we're presented with are toxic and often fatal. And these simple, non-psychoactive cannabidiol compounds are helping to turn that apoptosis mechanism back on. So you have cancer, when the cell goes bad, something's wrong in the cell, it's supposed to self-destruct. And when it doesn't self-destruct, and it keeps replicating in this bad form, that's what cancer is. And to create these cannabinoids work to correct that, the bond, the covalent bond that's broken, and then apoptosis can happen, and the cell can self-destruct, and this tumor can't keep going and going and going. And that's the really important discovery that we made here in the 70s at UVA, and it's basically the citation #1 over and over in these cannabis and cancer studies. We've had that data before us for years. We talk about FDA data, GW Pharmaceuticals, who we've all met here working on Epidiolex. They're completing phase 3 clinical trials right now on their Sativex drug, which includes both the CBD and the THC cannabinoids. They're showing that when you use this spray for brain cancer, glioblastoma patients who do not have a good chance that they don't have a good 5-year outlook. So they're using this spray in their mouth with their regular chemo, and the people who are using the spray are having a 30% increase on the efficacy of their chemotherapy. That's all they're adding is a couple sprays in their mouth. We are prescribed, the interesting thing about epilepsy and Crohn's and cancer patients is that we take a lot of the same drugs. We all take the same opiates, we take the same benzodiazepines, sleep medications, high doses of steroids, dexamethasone, antivirals, anti-anxiety meds, sleep medications, I mean, you name it, it goes on. And a lot of it starts with controlling pain because cancer is painful. The therapies that you take to survive it are very painful. And once you start taking opiates, there's a host of other medications that you have to take with it. This is not about getting high. These patients, Brian, myself, we can have all of the opiates we want. We can have all of the pure, unmitigated THC we want. In fact, we were talking earlier about Marinol and how it's dosed. So you would take a 5 milligram Marinol tablet 3 hours before you get chemotherapy, so it can start to work on your nausea. Then you can take another tablet every 2 to 4 hours, 6 times a day. And that's just to manage your nausea for chemotherapy. It's synthetic, so it's not having the same synergistic effect that it does with CBD on your cellular level. So the synthetic THC doesn't offer as many fantastic benefits. Okay, so you've heard my story, you've heard Brian's, and I would like to answer any questions you have.
Yes, ma'am. So on the second study, the Harvard study that Delegate Levine brought, okay?
Have it ready.
Now remember, I'm just a suburban lawyer, right? This stuff doesn't make sense to me. I want you to explain to me in regular person talk the last sentence. These results suggest that CB1 and CB2 could be used as novel therapeutic targets against non-small cell lung cancer. What does that mean?
That means the CB1 and CB2 receptors, so we have an endocannabinoid system in our body. We all make cannabinoids in our body. The first time you have a really high dose of cannabinoids, as most humans, is in breast milk. It's filled with cannabinoids. And this is where it kind of starts to make sense. Your endocannabinoid system, there's a lot of it, a lot of receptors, these CB1 and CB2 up in your head, really concentrated all through your head, through your lung and heart area, and very much much in your digestive tract. So these receptors, when it's breast milk in your infant, these compounds are coming in and making your infant's gut will often be referred to as leaky gut, and it's kind of open, and when you put these cannabinoids in there, they bond with these receptors and help fill out and complete your...
This says me.
It means that
if someone took CBD oil,
yes,
it would get
act on
into
the
these
CBD1,
receptors
yes.
and would help with non-small lung cell.
Correct, correct, and eliciting that apoptosis that makes the bad cells shut down.
Thank you.
I'm just a mom, I'm not even an attorney.
Delegate Gilbert.
Well, I mean, you sound like you went to medical school. I mean, you are an expert in this issue, right?
I had cancer twice, so I have to
But you
be
have become an expert not of your own choosing, right?
absolutely trial by fire.
Right. You know, and if it were me, or any of mine, I would do anything in the world to try to make people I love feel better and find whatever magic oil that'll do the trick. But you were here last year, right?
Yes, sir.
And your testimony was compelling last year, and it was compelling just now. But I personally have not heard a single thing about your particular issue, this bill, as it exists right now.
My particular issue.
Well, I mean, I haven't heard a thing about it since last year. And again, we're being asked on the fly to make all these judgments about your assessment of the scientific evidence off of one sheet of paper. And it seems to me like we had a year to work on this and to be convinced and to be, educated. And I would love that. And again, I have shown through my vote that I'm willing to go down this road. But I've only gone down this road because people have put the time and effort into convincing me that I needed to do that. And I'm not saying that your testimony isn't compelling. I'm just saying I haven't heard a thing about it since you did it last year. And I do continue to feel like there's a burden of proof that exists out there that must be shown before we go down the road that we're being asked to go down. I've said it before, I'm saying it, I said it on the last issue, and I have to tell that to you again. So, again, I'm open to it. I think we're collectively open to it. I just, again, I haven't, since last year, 15 minutes ago was the first time I've heard anything about it. So, I need to be convinced, is all I'm saying to you. But I appreciate everything you've gone through, and you may get me yet, okay? But I haven't heard it yet today. Okay.
Thank you. Any other members of the public like to be heard on this measure?
Mr. Chairman, members of the committee, again, I'm Regina Whitsett. In the study that I gave to you from the National Academies of Science, Engineering, and Medicine, it does state that there are therapeutic effects for nausea and vomiting and chronic pain, but it doesn't say anything about actually helping to treat cancer. So I just want to bring that to your attention. And CCOVA has been sending reports to senators and delegates throughout the past year with everything we find on marijuana, any studies we have out of Colorado, Washington, anything like that. But I do want to point out about this bill that this is it's all inclusive. It's for 160 different types of cancer.
Okay, go ahead.
Okay, and that includes skin cancer. And also in that National Academy of Science report, it says that it indicates there is no or insufficient evidence that cannabinoids are an effective treatment for cancer. So with that being said, we oppose this bill.
Ma'am, question for you, Mr. Chair.
Delegate Gilbert.
The CBD oil, it's non-psychoactive. Do you all at least agree with that?
No, we do not agree with that, and I'm not a scientist, and there's lots of people in this room that will probably disagree with me, but we've been doing research on this since last year when we were told that the CBD THC oils are not psychoactive, they don't have hallucinogenic effects. On that last form in the packet that I gave you, that's an email that we had sent to you all over the past year that has 3 different links that tell you how to make THCA oil into THC. And it's basically called a decarboxylation process. And when you heat up the THCA, it intensifies that effect and it becomes THC. So no, we're not in agreement that those oils cannot be psychoactive.
That they cannot be.
No, we actually do not agree with that either,
Tell me why
because we have sent you guys a chart that shows,
I didn't see any of that, so just tell me about it.
so Georgia and Virginia are the only ones that have 5% THC in the oils from the intractable epilepsy bills. And when I was on the Board of Pharmacy Regulatory Panel, I argued that that's too high. All of the rest of the medical marijuana states in the country is 0.3 or 0.3%. The 5% THC level is what used to be in marijuana in the 70s. And as some people have testified here today, that's not what's out there right now. It's 25% on the average in Colorado in oils.
Do you disagree that it has any of these medicinal effects for the specific cancers that have been suggested today?
Well, I just mentioned that according to the report, there are therapeutic effects for nausea and vomiting, but also Marinol and Sesamet will help with that as well. So we are following the scientific evidence of whether or not it has effects. But also in the same report, it talks about there's a modest evidence that cannabis use is associated with types of testicular cancer, and it's harmful in pregnancy. So there's other things that say it's harmful.
So if we were talking about making Marinol legal, would you be against that?
Marinol is,
I understand it is. Where are you against it being legal?
Marinol is a FDA approved.
I understand. Are you against that?
No,
Why
it's
not?
FDA approved
Okay.
with clinical trials and on numerous patients. And so no, Marinol's already on the market and can be used for some of these things that are side effects of cancer.
Okay. Thank you, ma'am.
Any other questions?
All right. Any other member of the public like to be heard on this issue? Matters before the panel? Delegate Alba. So, I mean, I know it shouldn't be me doing this research. I mean, I got my own bills, but I'm sitting here looking at the NIH website on cannabinoids, and it does say that they are effective. Cannabinoids can be effective in treating with chemotherapy.
That's correct.
Is there any studies that show that they have been tested by a scientific group like the National Institute of Health to help cancer, not the side effects of the chemo?
Yes, and I believe Ms. Peony knows all about that.
Okay.
Yeah, absolutely. GW Pharmaceuticals is in clinical trials right now with that preparation containing THC and CBD for glioblastoma. And it is showing that in conjunction with first-line chemotherapy, first drug they prescribe you that works the best, temozolomide, it's increasing the temozolomide efficacy by 30%. Most of that, the final report isn't published, and that's pretty typical as it gets closer to, for them to release it, they tend to pull off the preliminaries.
That follow up, Delegate Alba. Okay, so, yeah, if this thing doesn't pass this subcommittee, I'll make the same offer that I made for the Crohn's. I mean, we're going to work 14 hours a day. I don't have time to do the work. I need a document from the National Institute of Health says we did peer-reviewed studies that show that CBD and THCA oil can help. Because I can't really I can't legislate on my iPhone, you know what I mean?
Of course not.
This wouldn't be fair to my constituents to do that, so. Delegate Watts.
Thank you, Mr. Chairman. My comment will be somewhat similar to that. Last year, in a similar study, in a similar conversation, I believe that what was given to us several days later was a packet that had 17 or 20 such studies in it. I stuck it away. Someday I'm going to be literally buried in paper when it's all over with. But I did look through it several months later, and I read much more than I thought I would because it was quite interesting about shrinking cancer cells and tumors, etc. I will find that packet. I will give it to you, to Delegate Davis, and hopefully the homework that we're all looking for is in fact available. Because again, it has to come from all of you who have a network that can put this together properly.
I would just say, Delegate Alba, that the first study I gave you for Virginia Commonwealth University does say quite clearly at the top that it kills cancer cells. And I have two more studies if you want to see them. I've highlighted the appropriate parts. One is from the NIH itself, not quite finished in his clinical trial, I'd be happy to hand it to you now or email it to you.
Mr. Chairman.
Delegate Klein.
I'm pleased with what I'm hearing because, you know, I'm hearing developments that I hadn't heard before. Up until now, it had been my impression that the treatment was used to mitigate pain from various treatments for the cancer. Going to the underlying cancer is more promising. And we worked really hard last year. I worked really hard last year to come up with a bill that could pass on epilepsy specifically, because the oil went to the underlying illness. And so that's what I'm looking for here. And so I'm hopeful that we can be presented with more evidence to that point. And I'm hopeful. So I thank you for bringing this to our attention.
Okay.
I would be more than happy to pass around a lot of these studies, email the entire committee, and perhaps, I don't know if you have a chance to look at them before Wednesday, but these 7 copies of it, I'll put it out. One.
Where are we at?
Mr. Chair, I move to lay the bill on my table.
Motion to make the table the bill, is there a second? All in favor of tabling the bill, signify by saying aye. Aye. Opposed? No.
So you're satisfied now? No, I said if it doesn't survive.
All right.
All right, Delegate Levine, thank you.
Thank you.
All right, just so everybody knows where we're at, we are, this is the midpoint, that was 16 bills, we have 17 to go. They're not quite